Dr. John Zank, we're talking about 7-keto. Can you talk about some of the clinical trials and the things that you've done to show that it's safe for us to use?
Yeah, I'd be happy to. That's one thing that sets 7-keto apart from a lot of weight loss supplements, even dietary supplements in general. Before we even sold this compound, we did a phase 1 safety and pharmacokinetic study, which is a clinical trial in healthy volunteers to see how it's tolerated, check for hormone levels, check for side effects in their lab work. Then we did a pharmacokinetic analysis where we drew blood in these people. And so we basically can track their absorption and excretion of the compound. So it's one of the few dietary supplements out there where you can actually know what the half-life is. You can know how long it takes to get to peak plasma levels. You know what those peak plasma levels are. So it helps me as a physician and a researcher that works with this compound all the time to design really good trials based on those numbers. So that was the first clinical trial we did. We found that, and we knew from the previous research that it could actually have this thermogenic effect. So about in the late 90s, we did our first weight loss trial. Okay. We actually now have 2 published clinical weight loss trials, both of which confirm the other's results. So these were both randomized, double-blind, placebo-controlled trials, parallel designs where we have an active treatment group and a placebo group. And we're blinded. The researchers are blinded. We don't know who's who. We had similar numbers of patients in each one, roughly a total of 30. These were all overweight patients in their mid to late 40s, men and women. I think our average body mass index was right around 32. So they were, most of them, in the obese category. And we tested them over an 8-week period. The dose of 7-keto was our usual, which is 100 milligrams twice a day, or 200 milligrams a day. So at the end of the study, we found that we definitely did see a statistically significant difference in body weight and in body fat. And what we found was that in both studies, the patients that were on 7-keto, in addition to the 1,800 calorie diet and a little exercise, they walked like 3 times a week for 30 minutes, that the 7-keto treatment group had that particular treatment group losing 3 times more weight and fat than the group that took the placebo and were on the same diet and the same exercise program. In addition to that, we found out that 80% of the weight that they did lose was body fat. So instead of our usual weight loss trial, where it's maybe closer to 50-50, we're actually preserving muscle mass or fat-free mass. And so they're actually, doing what we thought they would do, and that's burn stored fat rather than, using muscle as an energy source. So both of those trials have been published in scientific journals. They've been reviewed by my peers and found to be accurate and complete and show something that should be known by the scientific community.
So 7-keto, based on these trials and the success you've had, is safe to use.
Yeah.
I mean, this is something that, not like Ephedra or things like that, but this is something that that can really benefit us if we put in the work too.
Absolutely, for sure, very safe. And I'm very confident when I say that, because we've done actually 10 clinical trials. Some of those were weight loss, some are for other indications, with 7-keto at varying doses, and controlled clinical trials looking for problems in lab tests, never seen them, always well tolerated, no side effects. So I'm confident when I say that I know it's safe, and I know it's effective too. I mean, it's pretty rare that you have 2 published clinical weight loss trials with similar designs that actually confirm the other's results. That means you got it right. The thing must actually work.
And you talked earlier about that it doesn't affect hormone levels. How important is that for us as we get older, when some people are taking hormone replacement therapy, and this is something that certainly we can then integrate without affecting that too, right?
Yeah, that's the one nice thing about it. I mean, that's where you might have a problem with using DHEA as a weight loss supplement. Because if you have women on hormone replacement therapy or men on testosterone for whatever reason, you could complicate the side effects from the drugs they're getting from their doctor. So 7-keto doesn't have any of those effects, so we don't have to worry about those types of interactions. And speaking of interactions, we haven't had any interactions that we know of with other existing drugs or supplements. 7-keto does look a lot like DHEA, and DHEA has an ability to inhibit platelet aggregation like aspirin does. That's why they use it for heart attacks. Sure. So there's a chance that 7-keto might have that same ability to inhibit platelet aggregation, which for patients that are on Coumadin or other blood thinners could put them at risk for bleeding. So we have that warning available just so people know.